Hello, my name is David Wynne-Jones, and I had the amazing opportunity to take part in 2 improving global health placements in 2019. My first placement was in Lesotho, working in a small acute hospital in a rural community, and my second was in Zambia, working with the National Blood Transfusion Service in the capital city of Lusaka. Before I left, I was Deputy Divisional Director of Surgery at University Hospitals Bristol, and I'm now the Divisional General Manager for the Heart Division at the Royal Brompton in London. Since returning from the IGH Fellowship, it's enabled me to innovate and lead to a higher level. The IGH Fellowship taught me a lot about the importance of setting a baseline to enable innovation, and the requirement for data that does not always have to be rigorous or detailed to spark this innovation. In Lesotho, I learned this quickly. I was used to accessing and analysing data with the support of a business intelligence team, and I was quite out of my comfort zone trying to measure outpatient efficiency without any data. In order to demonstrate improvement, we desperately needed a baseline to compare any changes against before we started. Working with the project team and hearing their ideas enabled us to come up with a fairly rough and ready approach that gave us enough data to make conclusions of improvement. The outpatient sister came up with the idea, and it was fairly straightforward. It was simply a slip of paper that circulated the hospital through the various departments with the patient. And the key to it is it didn't require any additional staffing or any additional staffing input. The big learning point for me was actually the easier the data collection when doing a quality improvement project, the better. There have been 2 quite significant leadership areas I've worked on as a result of my IGH experience. The first is around my approach to engaging the team, and whilst I was on the scheme, the value of engagement became clear very early on. Initially there was suspicion and some misunderstanding around the purpose of my placement in Lesotho. I had to build strong relationships and truly listen to the staff about what their challenges were and what projects they wanted to work on. Once I'd built these relationships, I was then able to harness so much more from my experience. I think the crowning glory of the placement was when we got the chief executive to hand out the graduation certificates for the QI school we'd created. The smiles, the singing, the dancing, it was an amazing moment during my time in Lesotho. The second significant leadership area I've worked on is around influencing results. Whereas in a normal hierarchical structure of an NHS organisation, there are clear levers and lines of accountability that can be used to influence team members, on both of my placements, this was certainly not the case. I had no authority, and I had to learn to practice a range of influencing skills to encourage support for projects and implementation of any changes. The most important takeaway for me was creating my own toolkit for influencing people from different cultures and different circumstances. I cannot speak more highly of the Improving Global Health programme. It was an amazing life experience that's allowed me to grow as a leader and learn a lot about myself and other cultures. Thank you.